Hi, my name is Alexandre Sadi, and I have the honor to present my work about the design of an ontology-based triage system for painful patients. I'm a PhD student at the University of Paris in France, and I'm also a medical doctor at the European Hospital Georges Pompidou in Paris. First of all, chronic pain is reported by about 30% of people in occidental countries. The amount of demand for access of specialist consultation in pain management program increase, contrasting with the lack of specialists in pain management. So the waiting time for a first appointment could be from 6 months to more than 1 year. As you can see, if you want to consult a pain specialist, you will have to consult a GP, then to do some exams of biological tests, and then consult a specialist like a rheumatologist. So the International Association Study of Pain published guidelines about benchmarks for waiting times for all disease. The aim of the project was to develop and implement a triage system for referrals to a pain clinic. The goal was to improve access to pain clinic with an automated process based on clinical practice guidelines. So as you can see, a GP can refer a patient to an hospital or a pain clinic. Then the process will automatically suggest priority for the consultation. And then the pain physician will collect the data in the electronic health record. So we call this project OntoDol. It's a knowledge base of expert rules and domain ontology, and we test it with a virtual patient case of complex regional pain syndrome. So what do we need to build ontology? We had to set the domain that the ontology will cover. So we need findings, disease, body parts, assessment scales, qualifier value, time duration, event or procedure, and of course, priority qualifier. We had to reuse existing ontology. So we check NCDO and Bioportal and OBHO Foundry repository, but none of the ontology we found could be used for triage. So we decided to use the SNOMED-CT. It's a huge, most comprehensive international clinical terminology which contains 350,000 concepts. So, but we had all the concepts what we need to construct ontology. And we also need time. Time is an ontology suggested by recommended by the W3C, and it will be used to define dates and duration. And we need to identify key clinical entities. So we asked an expert to read 2 clinical practice guidelines, one from the International Association Study of Pain, based itself on clinical practice guidelines from Canada, UK, Finland, Norway, and Australia. And we use one from France, published by the Health Authority. And we asked the expert to choose the smallest level of granularity with its times. We create OntoDol. So we import SNOMED-CT from UMLS. We choose the 2020 AB full release. And then we use the already 2 module with Python. We collect all the terms from clinical practice guideline chosen by the expert, and we map it with SNOMED-CT. We made a bottom-up extraction that we need the lowest granularity, and we get the top hierarchy. So it's automatic, and axioms are regenerated with object properties of interest from SNOMED-CT. As I can resume, we use clinical practice guidelines to extract concept and relation. We put it in a CSV file, and we use SNOMED-CT and Python module already 2 to map with classes, object properties, and axioms. And then we get an all file you use to create an ontology. If there is some concept which can be mapped with SNOMED City, experts have to read another time the list and map it manually with SNOMED City. Then we have to create swirl rules. Swirl is a semantic web rules language. We define priority rules with swirls. So we have 4 categories of priority, and we define this disease as an association of finding. It's different from defined classes used in SNOMED City. And we calculate the time duration between dates and with a swirl, like date of onset of symptom with current date or date of an event like a surgery. And then we made an evaluation of Ontodol. We made an evaluation of its intrinsic properties, and then we made an evaluation of its ability to classify patients with a set of 5 virtual cases of complex regional pain syndrome. So we create individuals to do that. So the result, we construct Ontodol with Protégé 5.5.0. We use Pellet as a reasoner because it can work with Swirl, and we save it in Roll2 file. So as you can see the metrics, we have 762 classes, 4,368 axioms, 92 object properties. We create 30 data properties, and we create also 62 individuals and 18 swirl rules. This is the top hierarchy of Ontodol. As you can see, it's a mix of SNOMED top hierarchy and time. So the intrinsic properties of Ontodol already is import automatically understable ADFS labels, preferred US term, and synonym US term. We provide textual ADFS definition, and Ontodol is based on guidelines published worldwide, so it's reliable. Ontodol covers a key element of the domain, allowing a closed word assumption, so it's complete and covers all the domain. And we check for consistency, and there is no problem. So as you can see, it's a swirl rules and based on an YASP recommendation. It describes the priority of CLPS acute phase, and you can see it's the most urgent. So the swirl rules is able to classify a consultation for pain who has a focus on complex regional pain syndrome, as its S phase, acute phase, and priority, high priority. Here is an example of one of the patients. So patient 1 has finding pain in the lower limb, a work disability, and a swelling of lower limb. On the right, you can see all the relation between clinical findings and the disease with localization of pain, the date of a certain symptom, the consultation of the patient, an evaluation of his pain, and the patient itself. And you can see that Pellet is able to infer that it's a complex regional pain syndrome of lower limb, and also other concepts. Then the consultation of patient 1, you can see it has a focus the clinical finding of patient 1, and a priority, and it concerns a patient one, you can see that Pellet infer that it's a consultation for pain and with a priority, and the priority is inferred as high priority. So here is all the patients we test. So you can see we chose all the guidelines, all the priority, and you can see Ontodol is able to do a triage and set a priority of these different cases. And there is a correlation between Ontodol and the International Association Study of Pain guidelines. So this project is the basis of for a clinical decision support system. We made a focus on CPRS, but we can do over triage for over disease, painful disease, but we need to add more clinical finding related to pain and create more rules. We use SNOMED CT for this interoperability with the electronic health record, but it's very heavy and we had to pipe all the concepts. And the chronic pain is a complex domain, but global public health priority. So we need to develop a clinical decision support system in primary care, as it's already done, but also in second healthcare. And the development of triage is a solution using concept of web semantic computing already used in other domain, medical domain. So we use a semi-automatic method to design Ontodol. It's an ontology for chronic pain referral management based on expert guidelines. Further works will add more classes, more rules. We can also include ICD, LOINC, or ATC for pharmacological data. And we can map it with the clinical data warehouse. And we will make an evaluation of Ontodol against standard of care with real patient cases. I would like to thank you for your attention. I hope you enjoy this project. Thank you very much.